Hi, my name's Courtney and this is my medication pass video.
My name is Sarah Campbell and I consent to being in this video later on.
Okay, the first thing we're going to be doing is logging into the EMR. When we log into the EMR, we're going to look at make sure we have the correct patient and review the patient profile. This is Michael Head, date of birth 4/24/1944, which is what we're looking for. Then we are going to review the order. The order is, these are our orders today, but for the video we're just going to be doing lisinopril. The order is for lisinopril 10 milligrams orally. We're going to make sure it's due at the right date and time. It's due at 1100. It's 1100 now. And you have an hour before and after to give it, but we're right on time. And then we're going to make sure it's on the right date. Today is 11/25, which is when it is due. So then we're going to look at the nursing implications. The nursing implications for this medication is blood pressure. So this medication lowers the blood pressure. So we are going to take vitals, which I took vitals on Michael and his blood pressure was at 176/90, which is high. Since this medication is going to lower blood pressure, this is an appropriate and safe time to give this medication. So then we're also going to review if there's any dietary recommendations or restrictions, and there's not in his profile. So then we're also going to review his allergies, which is sulfa. Want to make sure that's always done beforehand. So after we reviewed his allergies, reviewed all that jazz, we're going to log into the AccuDose. So once we're logged into the AccuDose, we're going to review the order in the EMR and in the AccuDose. So in the EMR, lisinopril 10 milligrams. And then over here, it is also lisinopril 10 milligrams. Now that we have that, and we're also going to review the allergies to make sure it matches in the AccuDose. So allergies in the EMR is sulfa. We're going to make sure, and the allergies listed in the AccuDose is sulfa. So now that we've got that matched, we can do the 6 rights of medication. We're going to start with the right patient, Michael Head, date of birth 4/24/1944. We go into the AccuDose, Michael Head, date of birth 4/24/1944. So we have the right patient. We're going to make sure it's the right time, which is due at 1100. It's 1100 now. And then we're going to do the right medication, lisinopril. We go over to the AccuDose, lisinopril. So we're at the right medication. The right dose is 10 milligrams. We're going to move over to the AccuDose, which is 10 milligrams, and then the right route is oral. So since this comes in tablet form, that is an oral form of medication, so that is appropriate. Then documentation will be done later. So after we've logged out, we're going to get the medication out of the AccuDose. So we're going to make sure it's the right medication. It's lisinopril, 10 milligrams, so that's good. Then we're going to check the expiration. It is not expired since it expires in 2022 and it's 2020 right now. We're going to check the integrity, make sure that it is packaged correctly, and it is. So then we're going to gather our supplies. We are going to make sure we have a medication cup and a cup of water for the patient. Then we are going to log out of the AccuDose. And then we're going to log also out of the EMR. And then we're going to move to the appropriate patient bedside. So once we get over to the patient bedside, we are going to introduce ourselves and wash our hands. I'm Courtney, I'll be your nurse today. Then we're going to identify the patient with 2 patient identifiers. Can you give me your full name and your birth date?
Michael Head, 4/24/1944.
Perfect. So then we are going to explain the procedure. Today we will be giving you your medications. Today we will be giving you lisinopril. Lisinopril is a blood pressure medication, so it's going to lower your blood pressure. Your blood pressure right now is at 176/90. So this is an appropriate time to give it because your blood pressure is high. So then we're going to log into the EMR. And I'm going to scan the patient's wristband. Scan. And then we are also going to look at the allergy band, which is sulfa, which matches the EMR, allergies, sulfa. So then once we have that, we're going to scan the medication. Scan. Then once we scan the medication, we're going to make sure it's the appropriate amount, which is 10 milligrams, which is what is ordered. And we're going to make sure it's given at the right time. It's 1100. Then we're going to scan the patient ID band again. Scan. And then we are going to do the 6 rights of medication. So first we're going to start with the correct patient, Michael Head, date of birth 4/24/1944, which matches the patient wristband. Michael Head, date of birth 4/24/1944. Once we've done that, we're going to make sure it's the right time. Time is due as 1100, which is 1100 now. We're going to make sure it's the right medication. It's lisinopril, and lisinopril is the right medication. The right dose is 10 milligrams. It is 10 milligrams. It's the, we don't need to adjust it or anything because it already comes in a 10 milligram form. The route is oral, and this is a tablet, so that's an oral form of medication, so that is appropriate. So then we are going to have the patients sit down. We are going to adjust them to make sure they are sitting upright. So once we have the patient sitting upright, we are going to administer the medication. We're going to make sure they swallow the medication. So after we made sure that the patient swallowed the medication, we are going to document that we gave them, in the EMR, we're going to document that we gave them the medication. After we document we gave them the medication, we're going to scan our ID band scan, and we are going to make sure that we verify and document the right time and date that it was given, verify the documentation was done, the time was done, and then we will log out of the EMR. Then we are going to do our closing statement, or closing, which we're going to make sure the patient's comfortable, dispose of our supplies, put the bed in the lowest setting, put the item and call light within reach, and put the side rails up ×2. Thank you.